Okay, we are live. Okay, so I have great joy in welcoming Dr. Vishesh to this beautiful interview that we're going to have. Dr. Vishesh secured rank 1 in the AIMS merit list and the common merit list as well in the recently conducted INISS May 2025. And to achieve rank 1 in this INISS exam, it takes a huge amount of dedication, hard work, and perseverance during the tough times, especially during the last few days before the exam when the mind games start to play. So, first of all, I welcome Dr. Vishesh and I congratulate him on the behalf of DocTutorials on this marvelous, remarkable achievement that he has achieved in securing rank 1. Welcome, Dr. Vishesh.
Thank you, sir. Thank you for the kind introduction, and special thanks to you and Dr. Twills, sir, in this journey, because Dr. Twills played a huge role. Both the videos and especially the question bank and GTS, they were awesome. So it
Okay,
helped a
thank
lot.
you. Thank you very much. So on that note, I would like you to give a brief introduction about yourself. Where do you completed your MS, and what you are doing right now? Because that would enlighten and encourage people, your juniors, to start this aggressive preparation. And I had a brief chat with you before the interview, and the way you told it, that was very impressive. So I would like to have that introduction. So go on and introduce yourselves and tell me how and when you started a preparation. That is very important for us.
Yes, sir. Thank you, sir. Actually, I am a resident of Ghaziabad, NCR only, and I did my MBBS from AIMS Rishikesh, and then my MS General Surgery from PGI Chandigarh. That ended in this February. And after that, I returned to my home, and I have been preparing since that, like before that also, and since that time from home only. So,
Okay.
first I gave NEET in March, and then I9 that happened in May. So for neurosurgery specifically, like overall for SS, I started preparing somewhere during fourth semester, I think. So
Okay.
fourth until middle of fifth semester, I studied about all the specialties because that's what we need to do for NEET nowadays. After that, the last of fifth semester and sixth semester, I think no one can do anything during that time except the
Yeah,
MS
yeah, yeah.
exams, and so that time went in that. Then in December, I started neurosurgery preparation specifically from drop tutorials again,
Okay.
and that was I like watched the videos and made the notes till January mid and all. And
Okay.
afterwards, I started reading Greenberg. So I read
Green
Greenberg,
book.
some important chapters from that. And sir, from from last week of February onwards, all this was mostly done. So after that, I revised, and while revising, I had a habit that every night, after dinner, I used to give a grand test earlier for NEET, and
Oh,
once the NEET was done for INISS, almost daily I used to give a grand test.
very
So I
good,
think
very
that
good.
helped a lot.
That's quite a preparation. Giving a grant test every night. That's the like the amount of time it takes to give a test, revise the answers. That takes because most people, what I have seen, they do give a test maximum once in 3 4 days, but giving a test every day, that's a big thing. That's a big deal, and that's very nice.
Yes, sir.
So I'll concise. So basically, you did your. So basically, you started your preparation somewhere around third or fourth semester, fourth and fifth semester. But then you started properly since December. You watched the videos,
Yes, sir.
you made notes out of it, and then you use the DocTutorials app for the test series and the grant test. And the grant test you attended once every night. That's quite remarkable and very nice. That's no wonder that you secured rank 1. That should have given you a lot of confidence in going about during the exam, I believe.
Yes, sir. It really had on the exam day too. There is always a bit of anxiety. That's okay, but I was very comfortable with the format, with the situation
Mm.
that was there, and everything. And even the questions that were difficult, it wasn't like I was panicking from that because facing such questions in the GT, so I had an experience that yeah, even if you don't know the question, first just start eliminating the options which you think
Mm.
that this can't probably be there. Then sometimes you need to listen to your gut also for marking. So yeah, those kind of things I think come only when you give GTs repeatedly again and again.
Yes, very good. So very nice because This is an eye opener for all the juniors, all your juniors, because attending tests, especially the grand tests, because that is attending this simple test like subject wise or topic wise test, that's quite easier, because you read a topic and you know the questions will be from that topic, and you attend it, you revise it, that's another thing. But a grand test is a whole different animal, because you have questions from everywhere: neurovascular, embryology, anatomy, physiology, every part, spine, every part of the important topics will be covered in the grand test. And when you attend so many grand tests like how you had done, that makes the difference completely. So, what was your revision strategy? Now that I think by February, March, you would have completed everything and you started your revision. So, what was your revision strategy for
So,
the
sir,
test?
revision, coming to a revision, like initially I had made notes for all the SS subjects what we need to study. So I revised those notes only daily. There was no set goal. I just thought that the maximum that I can do in a day, I used to revise that by like evening 6 or 7:30. Then I took a break for around 2 hours before dinner. And so that was the way for NEET and for neurosurgery, specifically for INI. Like once I revised the doctoral notes, I revised Greenberg also, whatever I had like marked with the highlighter in the book, because Greenberg being a huge textbook, it's not possible that we can read it entirely. So my strategy initially when I read it for the first time in February was to highlight whatever I felt was like high yield topics or which were unusual knowledge, unusual data. And only those selected extracts I had a look upon during, I think, April and May, just before the exam, and that helped a lot.
Okay, nice. So, what is the strategy for the last week?
Sir, coming to the last week, actually, in the last week, I reached a place. All the GTs were also like exhausted. I had no GT to
Yeah,
do, and I didn't do any. I didn't find a point to do the test right. So in the last week, mostly I what I did the previous year recall sessions that were there, the previous year INI recall session. Mostly that I did in the last week, and
very
rest
nice.
in last week I chilled a bit. I saw 1 to 2 movies in the last week to cool my mind off. So
Good.
that helps.
Very good. So you took the pressure off yourselves because you did so much of work during the earlier stages of the preparation. When you do so much of work, then the last few weeks you can go relaxed, and that's you have prepared and you have underwent an ideal way of preparation. To be frank, this is how an exam has to be approached. This is how an exam has to be given, and that is one of the main reasons: your hard work, your perseverance, and the way you approach the exam. Because the hard work and perseverance will always be there, but then how you approach the exam, how you plan for it, how you're executing that plan, that is what makes the difference between rank one and the rest of them. So I am absolutely sure that you deserve this rank, and you have got what you deserved. And okay, before we conclude the interview, how did you go about the interview? How was the interview for
Yes,
you?
coming to the interview, for interview also first I saw some of the videos which are there in DocTutorials, and beside that there is another source that I found helpful that some of my seniors told me. There is some platform by name of Exam Online on YouTube. So that is basically a platform for guys who are like giving MCH exam, MCH exit exam for their OSCE. But that helps because that helps you to prepare the kind of question that might be asked. So I saw those videos, and during the interview, as such, I found that it is broadly divided into two sections. They spend around 5 to 6 minutes knowing who you are exactly.
Yeah,
Like they
yeah.
asked me, tell us something about yourself. They were their exact words. They didn't ask, introduce yourself or anything. So I just introduced myself, and I was not able to say much. But I think if one can develop that thing, that would help even more in the interview, because I think the people, they want to assess the personality of the candidate, how well he or she can express. And then, sir, there were 4 to 5 OSCE where they had a slide, total 10 to 15 slides, and they were asking each candidate, I think 4 to 5 out of them per candidate.
Mm.
So
Okay.
I got like one, there was MRI diffusion weighted MRI axial slice was there. The patient had underwent some temporal meningioma resection 2 days back, and now there was a large area of diffusion restriction. So it was the usual question like which sequence is this and what are your DDs. There was a coronal CT showing the subaxial cervical spine, and they had marked something there. Like at that point, I didn't knew. I think I answered that question wrong, but it was the uncovertebral joint mark there.
Okay,
And
okay.
they asked about the reflex arcs of DTRs and phakomatosis and all those things. So
Okay.
overall, it was over in 15 minutes, and it was a good experience.
Okay. So you attended the mock interview as well, right? The previous the 2 3 days prior, we gave a mock interview. Did you
Yes,
attended
sir.
that? Okay. So what's the how did that help you in preparing for the interview as such?
Sir, again, like I said, that simulation is the key for exams. So it definitely helps the mind, helps you to the like mind to set in the mode, and helps to build your confidence. Like what happens when really the question is thrown to you from the screen. So yeah, it helped in that sense, I guess.
Very good. So again, thank you very much for your time, and I'm very happy that a person like you, with so much of hard work and perseverance, and more than that, the way you prepared. I believe this interview would help students across all the branches, leave alone neurosurgery, for all the branches. How you prepare yourself, how you conduct yourself during the few months of the just before the exam. That is very vital. And on behalf of DocTutorials, I take this opportunity to congratulate you on this marvelous achievement again. So
Thank you, sir.
I wish you all the very best to become a very successful neurosurgeon.
Thank you, sir.
Thank you. Thank you.